Hello, today we'll be going through the BTEC Award sample assessment material for Component 3. This is a walkthrough paper and examples of top tips, common mistakes people make, and content you should include when answering your exam paper. Vital information you'll need to know for the exam paper is that the paper is 2 hours long. However, that will depend on whether you have extra time. The total marks of this assessment is 60 marks. It's really important that you read each section carefully, especially the first section where you are requested to relate to pies, so physically, intellectually, emotionally, socially, also environmentally and economically. You will also need a black pen for this exam. It's important to know that your exam will always start with information about an individual that will form the basis for the whole exam. So this person they will talk to you at the very beginning will be the person that you continue to relate to throughout the whole exam. Please read it carefully at least twice before you start. Highlight and underline key terms and refer back to it regularly, as you will need quotes and examples in your answers. So section A, which is our first page. So once you turn the page of your exam paper, you'll notice that there is a vocational scenario. There's lots of writing that tells you about a particular individual. Please make sure that for your exam you have a minimum of 2 highlighters. You're allowed to highlight the page, have notes coming off it, that's absolutely fine. I would have a green highlighter and a red highlighter, or if you choose to use different colours then do so, but make sure you know which one you're going to use for underlining positive effects on an individual's life and negative effects on an individual's life. That really helps you as you go through the exam paper. Quickly mind map any important factors such as environmental factors, cultural factors and economic factors, and you might want to quickly pop down how they might affect your individuals. Add pies, arrows, which I'll show you in a minute, so you might want to have coming off the text all that relates to physical, this relates to intellectual, emotional, social. It's really important that once you've read through it once, you go back through and you read it again and you make sure that you make those notes so it's easy to refer back to. So as you turn the first page, you will see the vocational scenario. Here we have Brian Whittaker, who's 72 years old. We find out that he lives in a 2-bedroom bungalow, a small village, and that he lives on top of a steep hill. The steep hill is quite important to notice, especially as we notice on his medical history he's had a recent hip operation. So you might want to put a little arrow saying physical, tough for him to walk with his bad hip, let alone coming up a steep hill. He may find mobility hard. And then we move on to family, friends and social interactions. You get to see who visits him, who he visits, and whether he has any social interaction. You get his day-to-day lives. You notice that he has a walking stick to get around his bungalow. He can do his everyday chores. He struggles, however, he does struggle with preparing food. So you could actually underline that red. He cannot stand up for long, and he eats a lot of fast food. Straight away, you're noticing that could actually affect his diet. He's unable to walk or stand for long distances. So again, that could be a negative aspect that you underline. He finds it difficult to ask anyone to help him because he's proud of being independent. So you need to go through and highlight all the positive aspects of his life and the negative aspects of his life so that you can easily refer to it when you get to the questions. And as you see, I've just sort of with a couple of them highlighted some pies from the vocational scenario, which you may also want to do too. So the first question on this paper was to explain 2 factors that could have a positive effect on Brian's health and well-being. Now, if you used your highlighters on the previous page to underline what was positive and what was negative, you should just be able to flick back and look at what you underlined as green and start to answer that question quickly. This actual question here does not specify any particular pie, so any physical, intellectual, emotional, social, so you're free to discuss any 2 factors for this question. it's really important to actually look and see, oh, why that has a positive effect on Brian's health and well-being. It's not good enough to merely identify 2 factors. You then have to expand on it and explain. So the examples they've given you here is that the district nurse checks his hip regularly, so he's receiving professional care to help his recovery. If you just said the district nurse checks his hip regularly, that would only be 1 mark. So you need to expand and state how that is positive. Brian's house is a bungalow, so he will not need to struggle up and down stairs and put strain on his hip. He's had a hip operation. This should mean that he becomes more mobile and independent. It's really, really vital that you not only identify, but it is expanded on to state how it's positively going to impact on his life. This is an essential top tip, really. You've got to look to see what the command word is in every question. Are they asking you to identify, list, explain, discuss, justify? In this case, the question we just previously looked at, you need to it is to explain. So you need to provide a factor and give further information about how it affects the individual. Your answer may use the word because or therefore. You need to look at how many marks are being given. So if there are 4 marks, then you will then need 2 factors that need to be expanded on. In this case, it's 2 positive factors affecting health and well-being. So you'll need to look at all the content and pick out examples from the information on Brian. Remember, those highlighters will really, the work that you, sorry, the content that you've highlighted will really help you here. To help you understand how to answer this question further, I've given a little example of an effective response and an ineffective response. So Brian is visited by a friend on a weekly basis. This will have a positive effect on his emotional well-being as it will make him feel valued. You can link it to the pies because it hasn't specified a particular pie. You can actually relate it to a pie of your choice. So Brian is finding that his mobility has improved since his hip operation. This is a positive effect on his physical health and will mean he can be more independent when moving around the house. So the top one looks at emotional well-being and the second response looks at physical. Now, if we have a look at the ineffective responses, Brian could get more friends and family to come and visit him. This would make him feel better. This is not actually written in the scenario. You need to look at what's there. Brian could ask the district nurse to cook for him. This would help him. A district nurse, for one, doesn't cook for somebody. They come to visit to check up on injuries or change dressings or give advice about their illnesses to make sure to monitor them. So you really need to make sure you're aware of people's roles. You need to be specific in your answers. So the next question that follows says, explain 4 factors that could have a negative effect on Brian's health and well-being. So it's exactly the same way that you answer it. You go back to your first page where you have highlighted red and green, and you look at the red this time, so the negative effects on Brian's health and well-being. So it's a quick reference, go back, have a look. And as I discussed previously, one of those factors could be that Brian has a poor diet because of fast food. Then you need to expand on it because it's asking you to explain, which often have high salt and fat levels, so may make him overweight. So on this page here are some examples of some of the answers that you can give. It is not good enough to merely say Brian has a poor diet of fast food. That would only be 1 mark. So here are some effective responses for this answer. Living at the top of the steep hill could be having a negative effect on Brian's health because it would be difficult for him to go out on his own and therefore he will not be physically active. You could say that it could result in him gaining weight also. So we now come to question 2. This is where you get given more content. So they add more contextual information. So we find out Brian's wife, Enid, died. She's been ill for several years. He was the main carer. He visited her every day in a care home, chatted to other residents, staff members, and he travelled to and from the care home via taxi, and he got to know the taxi driver well. However, since Enid's death, he hasn't been back to the care home. So what I did was I started to link to pies and started to think about the ways in which this could actually affect Brian. The question then asked for explain 3 effects that Enid's death could have on Brian's social and emotional well-being. I've sort of looked that his wife's died, which obviously is part of the question, so we don't need to mention in too much depth again. Socially, he used to chat to staff members. He'd made friendship with the taxi driver. He's no longer needing to go to the care home. Before he had a purpose, now he hasn't got a purpose anymore. So I've sort of underlined all those key points ready to answer the questions. And the type of answers they're expecting is that Brian is no longer caring for her, so he may feel that he is not needed anymore, like I discussed previously. Brian has lost his friendship group in the care home because he's no longer visiting the care home, so he's more likely to become socially isolated and alone. Remember, both of these are considering social and emotional. You're not there to talk about physical or intellectual. That is not what the question's asking for. Prior to answering this question, it is important that you read through, and you might even want to highlight in a different colour highlighter the social and emotional, so it reminds you to stick to those and not go off on a tangent. Brian may be relieved that Enid is no longer suffering, which will reduce the stress Brian may have had for caring for her. So that's taken another look on this question. Brian may have felt supported by the care home staff, which would help him cope with bereavement better. So it's a more positive outlook. Here are some other examples of effective responses that students have written in the past. So Brian no longer has any reason to go to the care home, which means he has less social contact with others. So he might feel lonely, which would be a negative effect on his social well-being. It's a very detailed answer. Brian no longer meets people such as taxi drivers, as he has no need to leave his house. He may feel stuck at home, and that would be a negative effect on his emotional well-being. In some ways, it may be a relief for Brian that Enid has now died and isn't having health problems anymore. So this could be better for his well-being, as he doesn't need to worry anymore. Top tips then I would bring in on this part is that you've got to try to think about using excerpts from the scenario and wording the question in your own answer. Only use what's in the scenario. Don't start making up things that aren't written there. Don't start saying that he'd made a best friend at the care home and they're still going to keep in touch. You don't know that. It doesn't say that. You've got to provide different factors and don't repeat. And remember to provide enough information with every factor to explain the effect. So we now move to question 3, where we're giving yet more data. This one is the question where you will be expected to analyse their BMI, perhaps their blood pressure, pulse rate, temperature, peak flow. And you'll be given information to be able to do that. You may be given some graphs, some charts to have a look at and read, to focus on working out whether they have a high BMI, low blood pressure, high blood pressure, for example. So you get a little bit more information about his lifestyle data, his physiological data, and guidance for physiological data. You've got to read this section carefully and highlight and underline key information again. So we learn that he used to smoke 30 cigarettes a day, but since his operation, he's cut down to about 5 a day. So we know that he smokes. He likes a couple of glasses of whiskey before he goes to bed, but he has started to drink in a day. So this is extra information that has been found out about Brian. Make sure you underline those. So this question you'll have all the physiological data about Brian, and you will be expected to interpret it and say what his blood pressure or BMI in this case are. Are they good? Are they bad? You will then be expected to explain what the data you have analysed suggests about Brian's current physical health and risk to his future physical health. So the first section you'll get about is about lifestyle data. This is where lots of students make a mistake. You've got to remember what lifestyle factors are. So it's things such as drinking, smoking, drugs, exercise, diet, and hygiene. You don't need to mention anything else in this section, because you will move on to BMI and blood pressure or whatever they've chosen you to focus on. But the first question in section, or the first section in question 3 will be about lifestyle data. So you have a look. We know that he drinks, we know that he smokes, and that needs to be mentioned there. So you've got to use subheadings given and ensure your answer addresses exactly what's being asked for. 12 marks are available in a section, and there are 6 subsections, so each one requires 2 marks worth of writing. Don't waffle. You will have enough space here. So if you're going over that, you probably are waffling too much. Try to actually keep to specifically answering this question. When you are revising this section, it's really important that you're aware of consequences of poor lifestyle choices, or consequences of having a high or a low BMI, high-low peak flow, high-low weight, temperature, pulse rate, for example. You've got to be aware of the consequences of not leading a healthy life. They are not really going to pick somebody that has had a wonderful, healthy lifestyle. They need you to be able to talk about this person and talk about what's wrong with them and the consequences of their lifestyle, or perhaps them having a high BMI. What could that lead to? So there's a very small chance, a very rare chance, that they'd actually be a healthy individual. They need you to be able to identify aspects of an individual's lifestyle that needs improving. So here's some examples of effective responses. For example, the first one would be lifestyle data. So Brian smokes cigarettes, which will reduce his physical health. You might then go on to, for example, may make him cough or short of breath because it irritates the lungs. In the future, it could give him mouth or lung cancer. However, he's cut down from 20 to 5 a day, so he's trying to make improvements. So you're linking to the scenario, you're linking to the evidence you've been given. But with alcohol, he might be having too much, as he has whiskey at bed and then drinks in a day. So you've identified both of the lifestyle factors that could affect him, because it mentions his drinking and his smoking. This can make him forget things and not look after himself. In the future, it could mean that he gets liver cancer. So the consequences are mentioned. And then there's the same for the BMI and the blood pressure as well. When you are discussing things like the blood pressure, BMI, peak flow, please actually put the measurement the measurement you found down. For example, Brian had a blood pressure of 160/92. His high blood pressure might be because of drinking alcohol and being obese. You've got to state whether that's a high or a low blood pressure, which he actually doesn't do in this example here, and it should do. In regards to his BMI, he does mention what the BMI, his BMI puts him into the obese category. So please sort of like analyse it to state whether it's high or low or normal. We now move on to section B. This is the 4th set of information you will be given to read. So you must go back and recap on the first 3 sections to be able to answer this next question. Again, underlying is vital. Section B is about designing a health and wellbeing improvement plan. So you've got all the information previously from questions 1, 2 and 3. Then they will give you some more notes. This one, for example, has been taken by the practice nurse, Mrs. Smith, on Brian. And you find out he wants to keep his independence, have a better social life, lose weight, etc. But he doesn't want to stop drinking completely, give up fast food completely. Other information you need to know is that he's tried to give up smoking before but found it difficult, and he has low levels of motivation. These all must be considered. You really must pay attention to this page when you are setting targets. You can't make up any of his wants. You can't say he doesn't want to go and meet new people if he does. You have to use the information that's provided to you, and you must make any targets you go on from here smart. So it's really important that you go back, you revise SMART targets so that they are specific, measurable, achievable, realistic, and have a time scale. So the question 4 would be design a health and well-being improvement plan for Brian. It should include 3 recommended actions. Should set short-term, so less than 6 months, and long-term targets, more than 6 months for each recommended action. Give 1 source of support for each recommended action and explain how the source of support will help Brian achieve the target. If you just put down a source of support is a nurse without saying how it will help, you will not get full marks. Use the headings given and ensure your answer addresses exactly what is being asked for. Even if you aren't provided with the subheadings, you can still follow the structure. There are 12 marks available. Targets should be SMART. They should also be person-centered. They should reflect the individual's needs, wishes, and circumstances. This will get you the higher marks. Sources of support can be formal, so people that are professional or qualified, trained in their job, such as a nurse or a doctor, or they can be informal, such as a friend or a neighbour, someone that isn't trained. But they should be appropriate to the action that you've given. Think about what you're asking someone to do. If they're obese and have a low peak flow, you're not going to say, right, I want you for a recommended action to go on you're going to lose weight, so you're going to go on a 40-minute run. They're not going to manage it. They're actually going to probably have a heart attack and end up being rushed to hospital. So you really, really need to make sure that any targets you set are realistic and applicable to the person you are talking about. It's very important to know what's going to get you the higher marks when the examiner goes to mark it. It's very important you pay attention to making sure your targets are realistic and specific to the person you're talking about. So remember what I just said on the page previously, that you can't send someone that's obese, who hasn't done exercise before in their life, for a 40-minute run. It's not going to work. They're not going to be motivated. Brian hasn't got much motivation anyway, so you need to think about setting him attainable and achievable targets. They need to be specific to Brian. So you're not going to tell him to stop, to cut it down to 10 cigarettes a day when he's already on 5. You need to make sure you've read the information and you know where he's at now to help him achieve the target that you've set him. Here are some examples of the answers for the recommended actions 1, 2, and 3. It's quite important that you stop this page and you actually have a little read of each of these answers that people have given, and look at how they've answered the section source of support and how it will help. So remember, you're not to just say a nurse, you've actually got to explain how they could help. We now move on to question 5. This question, before you answer it, you must sort of know some of the key words here. So you're actually asked for the rationale, which means the reasons behind the plan you have chosen, why the actions and targets will help improve health and well-being, whilst also taking into account the person's needs, wishes, and circumstances. This is an extended writing task. It is a lot longer than what you've been asked to do previously in the exam paper. There are 3 parts to your plan. And you'll need to justify in turn with enough for 3+ marks for each. To break it down, For this question, you are basically telling the examiner why you chose the recommended actions that you did. So you would have recommend actions 1 and why you chose them, and how it takes into account his needs, wishes and circumstances. Recommended actions 2, and then exactly the same, and recommended actions 3. So you're trying to prove why what you put is a good idea and how it will help. You've got to make sure it's person-centered. So how does it take into account what he needed? What were his wishes and circumstances? Furthermore, you must link to the information you've been given. So number 1, use information you've been given throughout the exam. 2, why did you choose the recommendations? What was your purpose? Think about the data and information. 3, have you considered the individual circumstances? So go back and check. All right, if they haven't got much money, they don't have much money, then you need to think about what you've given them for an action. So you can't start telling them to join a gym or pay for a personal trainer or to go and see a specialist or join a slimming club if they cannot afford it. You need to justify each recommendation you chose. So it's about backing up what you say. Again, if we look at the higher marks and what's expected, you need to make sure you've considered the individual's needs, wishes and circumstances that were mentioned earlier in the paper. If you have not done this, you will not get the higher marks. It's actually worth stopping the PowerPoint here to have a little look at an example of an effective response to this question. I'll just read a part of it. So Brian has a high BMI and therefore for the benefit of his health, he needs to lose weight. When you're obese like Brian, you're more at risk of certain diseases like diabetes and heart disease. This could be why Brian has a high blood pressure, so having a plan to lose weight is a good one. My plan suggests that his first target, which is a short-term one, is to start making healthier food choices for breakfast. This is being person-centered as Brian doesn't want to stop eating all junk food completely. Because Brian is older and lives on his own, he might find making healthier food choices harder. So I've recommended that he gets the support to make these changes from the practice nurse at his GP surgery. The nurse can ask him what he likes and help him plan better breakfasts. The long-term targets for this is to limit junk food to 2 or 3 meals a week. So can you see they've given, they've been more specific. So they've given sort of, right, okay, 2 to 3 times a week. That's something that can be measured and it gives you a target, so it can help motivate you, which I think he can do in 6 months or more. He will be able to do this if someone like a care worker can be found to come and help him make better meals, because Brian isn't so mobile now because he has a bad hip. So this is an example of an effective response. Please stop the PowerPoint and read the other 2. Question 6 is about looking at obstacles or barriers to what is stopping this individual from sticking to their plan, and how can these things be overcome? There is an easier way to answer this question. So you get a question about the obstacles or a barrier, if it's easier to remember it that way. You come up with 3 main barriers. And I highly recommend you use this template here. For example, you name the barrier. So geography could be a barrier in this case. How will it affect the case study? Well, he lives in a small village, no access to a gym or no access to many facilities. And how can he overcome the barrier? And you've got to give ways of how you would overcome the barriers that he may be facing in an isolated village, for example. Think of realistic ways of overcoming these barriers. If you come out of some wild way, like for example, how he could overcome his lack of mobility, and he said, well, he could walk to the village 10 miles away, and then when he gets there he could do a Zumba class. That's not going to work. He's just had a hip operation. It's not going to be something that is effective. So although this one doesn't specifically go towards Brian, you could think about ways in which Brian could get exercise or could exercise in his village, but you need to think about it being realistic. On the grading criteria, it's suggesting how obstacles can be minimised, looking at how realistic your answer is. For example, if you're telling someone who's no money to get a personal trainer, that is not realistic. And here we have some more examples of effective responses. So it may be worth stopping the PowerPoint and going through this, having a little read of the way in which a student could possibly answer the exam question. The night before your exam, please read through common obstacles people face and ways of overcoming them. Remind yourself of SMART targets. You must make any targets given SMART. Remind yourself of the differences between economic, environmental and cultural factors. This really catches students out, especially the difference between economic and environmental. Before this, there has been no real smokers in the exams. Read up on strategies to help people quit smoking, but that may well have changed since this has been released. There has been no female case study so far. There has been no real personal hygiene so far, and there's been no real drugs so far. Where can you get help for drugs, for example? Have a look at some of the places or types of support for drug abuse in adults. So the day of the exam, hopefully you'd have had a good night's sleep. Please eat a breakfast, even if you don't normally do this. Even if you have to just eat a banana, get something inside of you, please. Have a nice glass of water. Read through the common obstacles for the last time. Try to relax. In the exam, try to apply your common sense first. If you have an old man that wants to exercise, do not send him on a 5K run if he's never exercised before. Start him off walking. So think through what you are asking somebody to do. Think about if you were told to do that, or you had to tell your granddad or your grandma who may be very similar to do something like that, and you're thinking they probably can't manage that. Yeah, you're right. Try to think about the person you are focusing on. Lastly, good luck. I hope you absolutely smash the exam. I'd just like to finish this PowerPoint by saying thanks to all the health and social care teachers that contributed their work on the Facebook site, Health and Social Care Teachers. Much of the content is adapted from one PowerPoint and one Word document submitted plus my own. Thank you to Louise Parkinson, who's allowed me to adapt this PowerPoint to share.